Hi, today I will talk about Ozempic, the hottest drug in the country right now. Ozempic is a medication that belongs to a class of drugs called GLP-1 agonists. These drugs are safe and effective for people with type 2 diabetes. However, did you know that Ozempic and other GLP-1 agonists have a side effect that may be beneficial for weight loss? In this video, we will discuss what happens when you stop taking Ozempic and other GLP-1 agonists. GLP-1 agonists for weight loss were discovered around 10 years ago. In the world of obesity medicine, it was discovered that GLP-1 agonists have a side effect that may be beneficial for weight loss. Fast forward to today, one of these medications has been FDA approved specifically for weight loss for people who are obese or overweight. Of course, like many medications, they are also used off-label, specifically and deliberately to affect weight loss. These medications are usually injections that are given by the patients in the belly once a week. So what are the side effects of GLP-1 agonists? GLP-1 agonists are generally well tolerated, but one of the ways in which they work is by slowing the emptying of the stomach. Therefore, one of the side effects, not surprisingly, can be nausea. In some cases, even vomiting, diarrhea, or bowel issues may occur. In rare cases, pancreatitis and inflammation of the pancreas may occur, which pancreatitis is the inflammation of the pancreas. So I would definitely stay away from any alcohol if you decide to take this medication, because it may inflame pancreas even more so. These drugs carry a black box warning for a rare type of thyroid cancer. So if you have someone in your family diagnosed with this type of thyroid cancer, it's better to avoid this medication. It should not be used. So what happens when you stop taking Ozempic and other GLP-1 agonists? What happens if someone were to take Ozempic or other GLP-1 agonists, lose some weight, and then discontinue or stop taking the medication? It's variable and not one size fits all. Individual results and long-term results will tend to vary. However, we have to remember that the conditions of overweight and obesity are complex chronic disorders that have a multitude of factors leading to them. Behavior, environment, genetics, and even other medications that may be associated with weight gain are a big part of the picture. Therefore, if you remove one of these variables, in this case, a medication that has been helpful in achieving weight loss, it is possible, if not likely, that the person will regain some or even more of the weight that they've lost. It all depends on how much was lost in the first place, the person, and the individual specific factors. These medications are quite safe and they have their benefits. But at the same time, we should not forget about particular side effects that may happen. We should be vigilant about them and try to use medications such as this as short-term as possible to achieve the best results possible while working on our lifestyle, diet, environment, toxin elimination, and other things that could be causing the weight gain. Because unfortunately, weight gain is not an issue of willpower. Once you gain that weight, it becomes hormonal tissue. It makes its own hormones. The whole body composition is changing. Everything is changing. So it's not just as simple as we used to think, exercise more and eat less. That's not how it works, unfortunately. And people who are struggling with losing that gained weight that they maybe didn't have or acquired recently, they are in so much trouble and in so much pressuring themselves to look better, to eat less, to exercise more, and eventually with very little results in a lot of cases. So before jumping to, oh, let's not take this or that medication for weight loss, I would definitely consider some medications for weight loss and use them as carefully as possible in a short term as possible. Thank you for watching. That was Zhanna Tarjeft, nurse practitioner. Please leave your comments below, and I'd love to hear your story. Bye.